Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey, and today in the studio, I have a patient of ours who's a VIP patient. And the reason I say that is she's been with us now, we just talked about it, 17 years. So, Jaime, welcome to the podcast.
Thank you. Yeah,
So
it seems like yesterday.
I know. I'm like, God, we've known each other so long. How long has it been? And you said 17 years. And I was just like, how does that time fly?
I know.
Plus, we haven't changed at all, right?
Right. So, no, not at all.
So tell us a little bit about that very beginning, like when you came to the center for the first time, why you were coming, who you saw.
Yeah, for sure. So I made the decision to have an augmentation and lift after giving birth and breastfeeding 3 kids. So each of my kids kind of sucked the life out of me for like a year each. And so year plus. And so by the time my daughter was getting ready to wean, I thought, okay, summer's coming up. We spend a lot of time at the river and I'm in a bathing suit a lot. I've never had an issue with, being in a bathing suit. And I was getting a little bit like, oh, I'm not very comfortable after nursing 3 kids. So I made an appointment with Dr. Brahmi. He was phenomenal. I did see a few other doctors at a few different facilities and just loved his bedside manner. Everything about him made me feel so comfortable. So we went ahead and, in the beginning, I wasn't sure what I wanted. I just wanted to feel normal again because, wearing clothes and bras and bikinis was just almost impossible. And so I wanted them to match my body. And so he kind of had an idea of what size he would try, I guess. But being that I had a really large pocket and grew up with a 34D breast like through high school, he wasn't sure kind of when he got in there. So he had said he would do between a 400 and a 550. And I trusted his judgment. And so I remember waking up the next day thinking, oh my gosh, what size did I get? And I looked over on my card on my side of my bed. My husband had put it there and he had put in 550. They looked amazing. So that's what I needed. He said that every other implant was kind of swallowed when he sat me up. So
yeah, and that's what's so interesting, I think, about implant sizes is that a 550 on you versus a 550 on the person next to you can be so different depending on your anatomy.
Right.
And that patients who are thinking about a breast augmentation shouldn't really get hung up on the numbers because what your friend has is not necessarily what will be the best for you. So that surgery, okay, fast forward, because now you came in for a post-op today or a follow-up.
Yes.
And so fast forward to now, what surgery did you have and why?
Yeah, I had the exact same surgery, but went with a much smaller implant. So I had toyed with the idea. I actually came in a year ago and had talked to my husband, like, my breasts had changed and they were just really big. So, they change over the years and you get more breast tissue as you age. And so I was 46 at the time and was like, okay, well, I'd like to get them done before summer. This was last year. And then life happens. And I wasn't really sure what I wanted. I toyed with the idea of actually having an explant because I think I actually reached out to you and I talked a little bit about it and talked to some friends that had had an explant, talked to my husband about it, and just figured, I'm almost 50 and do I need to get implants put back in? I do have an autoimmune disease. I have Hashimoto's. So decided to get my blood work done and see how everything was going. My blood work is like the best in 10 years. So wasn't worried about any type of, the breast implant illness or anything like that. My body was not rejecting anything. So anyway, fast forward a year, I had told my husband, I think I'm ready, and decided that I wasn't ready to get an explant. I didn't have any issues associated with it. We still spend a lot of time vacationing and at the river, and I want to feel comfortable in a bathing suit. And my main issue was the size is just, I could find bikinis that fit me. It wasn't an issue, but putting clothes on, I just always felt bigger than I was. And I just wasn't happy. Very uncomfortable too. A 550 implant with breast tissue on it, which I didn't have before, was a lot different. So I had like that waterfall kind of effect where the breast tissue was gathering at the bottom of the breast. And it just wasn't comfortable anymore. So decided to make an appointment. I had a few friends that had the same procedure done with Smoot. And so I decided to come in and take a visit, and he was phenomenal. Same thing, like all the physicians here, the bedside manner is top notch. Like I would 500% recommend any physician here.
And so was it a straight like remove and replace, or was there like tightening of your skin needed?
Oh yeah, I had the full lift again.
Okay, full lift. And then did he use any like internal support, or did you need that?
No, so that was one of my main questions too, is I was worried that I would kind of fall into the same place as I felt the first time, is that my implant would get swallowed into my body and they'd have to put a large implant in again. But, 17 years ago was much different than today. So they have a lot of different options. And Dr. Smoot had said, I've basically 3 different things I could do. I can shrink it, I can put mesh, or I can sew it up. He's like, I think by shrinking it, which he said they basically like put hot water on it. I was shocked. He said that usually does the trick. And so we had decided to go with between 210 and 275 implant. But again, he didn't know what there would be until he got in there. And so just wanted the best to kind of fit my body and not be these large breasts. That's the first thing you see when you look at me. And so, yeah, he did full lift with the 275s. And that was, I think 7 weeks ago today.
So how's the healing been? How is it like easy or not so
super
easy?
In fact, I will say I wanted to do the surgery on a Friday. And I think because I had the surgery before, he doesn't typically do surgeries that meant on Friday. He had agreed. And the next morning, he had my husband just FaceTime him. And so I'm sitting there and he's taking the bandages off, and I, was kind of out of it, but he was really concerned with my right nipple.
Oh.
And so he's like, I don't really like the look of that. And so I'm getting hot thinking, oh no, what's going on? And had my husband take a few pictures of it, sent it in to him. And then I went back up to bed. My husband came and got me and said he needs us to meet him at the surgery center. And I was like, oh gosh. So when we got here, he was waiting in valet for us, opened the door. There was nobody here. And he had already called his OR in case he needed to take me into surgery and do a graft. So he's like, it's okay, don't worry, but these are the 3 things that could happen. Best case scenario is literally what happened to me. So he sent me home with some nitroglycerin paste and said, had my husband keep an eye on it, sent some more pictures in, and it was great. There was no issues.
Gosh. So really, and I think what happens, or what can happen with any incision, really, whether it's your breast, your tummy, is that if the blood supply, right, to that area is sort of not as strong as it should be, that tissue, the risk is that tissue dies. And so that paste is what they can put on it to help prevent that from happening, I think.
Yeah.
So
is that great?
So how did you feel like as you were having to get back in the car and drive down? Because you're up in like North County.
We're in Alpine. No, we're in Alpine.
Oh, you're in Alpine. Oh my gosh.
So yeah, I mean, I trusted Dr. Smoot, and I just loved that he didn't want to risk it. And he had me come into the office right away on a Saturday morning when nobody was in here,
Yeah.
So again, I feel like worst case, he would have had to take me into the OR and do a skin graft, but I mean, I would have been okay with that. I just feel like it's, so yeah, I mean, it's just been such a great experience. And then my healing, it's very sore. I don't really remember how I did that with toddlers because my daughter was 11 months old and my son was only 18 months older. So I had 2 toddlers running around with my first surgery. And I feel like I was, pretty sore and laid up for a few days. But other than that, it was easy peasy.
Yeah. And I think you're bringing up that kind of life changes, 17 years. I mean, implants are not lifelong devices,
right?
But 17 years is also, we each we're different people than we were then, and we want different things. And of course, our bodies have changed. And you mentioned sort of menopause, perimenopause, all the things that can happen hormonally and with tissue. It's like, wait, where is all this coming from? And how to sort of deal with that. And it's interesting that you sort of considered just taking them out completely. And that it's good that you sort of had the time to really consider, like, what does that mean? And if I did that, would I be happy? And the fact that you weren't having any issues, I think, is key. And I think Dr. Smoot really, poor guy, he's really become almost famous for being the secondary implant specialist. If somebody's having another surgery. If let's say a woman's having a lot of capsular contracture, her body's creating all that scar tissue that forms around the implant, and then it makes the breast feel hard.
Right.
You know, that can get really complicated. And he's like the guy, the go-to guy for trying to help solve complex issues with breasts. And even if they're not complex, I think it kind of speaks to we have 6 plastic surgeons here, and it really speaks to them working as a team, that they're like, okay, I might have done this surgery, and my friend down the hall can do a different surgery,
Yeah.
And it's nice to know that it's sort of like, this is your home base, and we'll help you. We'll help take care of whatever it is. And it was so cute because you were messaging me through Facebook, and I'm not in there that much. It's like I've done social media for so long for businesses that I'm kind of like, okay, I'm not in there that. And I was like, oh my gosh, she's messaged me like 5 weeks ago. I'm so sorry to be like,
okay.
Hi. But I think having those like lifelong relationships with patients, I sort of like look at you and I'm like, oh my gosh, I remember you were in an ad campaign of ours a long time ago. I don't even remember what it was, but you were like, yes, I'll be a model. And it was so sweet. So I really appreciate you coming on the podcast to sort of tell the story. And in terms of just like mentally going into the surgery this time versus last time, was it easier or about the same? Or
I think my life was, I don't want to say chaotic when, 17 years ago, but I was young and, I have these babies, and I think I was just in a different mindset than this time. This time I was a little anxious, not knowing what the results would be. I wasn't worried about the results, but I just didn't know. Like when I went with Dr. Brahmi, he had the pictures that my inspiration photos on the walls. And I just didn't do that this time because I was just wanting smaller and just to fit my body. So I left it up to him, and I just didn't know. And, obviously was anxious and excited at the same time. So, but again, just a different mindset than, when I was much younger.
So what was it like? You're walking into surgery 7 weeks ago with 550cc implants, and then you go home with two something. Would you say
275?
275. Yeah. Like, how did that feel on your chest? How did that feel sort of as a person? And what was your sort of mental state around this new you? Because it's really probably very different.
Right. Very different and very exciting. I'd been thinking about it for so long. And again, it wasn't like, fly by the seat of my pants decision. I really thought hard and long about it. And my husband supported any decision that I made. He's, even the first time when I got it done, he's like, you're not doing this for me. I love you regardless. But this time I just thought, yeah, it felt great. Like I felt lighter. I had these constant knots in my shoulders, and I just thought if it was from working in the computer every day. But to tell you the truth, I haven't had a single knot in my shoulder blades since the surgery. So that was a lot of weight on me and for my frame. And so, I think they maybe came out of the pocket a little bit. So I'm very excited for summer and to be able to wear my cute sundresses that I've been holding in my closet that, I maybe wasn't comfortable wearing because all you saw was big, large breasts when I put them on. And, exercising is a lot easier now. And
I would think. And so when were you cleared to start exercising again?
So to be honest, I've been traveling a lot and I haven't been exercising a whole lot, but I think now I can go back to normal activities being 7 weeks, like light weights, but I do have a Peloton at home and do a lot of the Peloton classes. So I'll be getting back into that now.
Yeah.
But, it was hard, like finding a sports bra that would fit because I had a small rib cage and a small waist, but then these large breasts so it was really loose underneath, but it had to fit the top. And so just excited about the normalcy of going to the store and buying, a sports bra to put on. It's like the simple things like.
And it fits.
It fits. So I was wearing, like a large sports bra or like a bralette. And now I'm in a medium. So that's like, I don't know when I've worn a medium before.
Well, that's so good. Nice. And I think, having that continuum of knowing, okay, we had them 17 years ago, you have a new set, but you're young. And so there's still probably something down the road at some point, and you might decide, yeah, I just want them out. Or
Mhm.
you might say, nope, I'm going to keep them small, but I want to trade it,
Right.
as your body changes. And I think, and hopefully, since we've been around almost 36 years now,
Right.
that in 15, 17 years,
Yeah.
you can do that. And you might
Right.
be messaging me on some whole other
Right.
platform other than Facebook. And
Right.
I'll
Oh
be
gosh,
like,
that's scary.
I'm here for you.
Right.
So, what would you say to a friend or a family member who is thinking about making a change like this?
I think it's important to do it for yourself and not for, your husband or for other people. You really have to be comfortable in your own skin. And it's not that, I mean, if I hadn't have had the surgery, I'd be fine. I still would have been in my bathing suit, like no big deal. But, again, you just really have to look to yourself and take the time to reflect and really understand what the surgery entails and why you're really doing it in the first place. But ultimately, I feel like if you're doing it for yourself, the only result is going to be happy. I mean, mm,
Yeah. And to know that, those hiccups that could happen, it's
mhm.
very interesting talking about having to go back into the office that next day, but then, it's not like the doctor's blowing off the phone call and, oh, it can
No.
wait till Monday. Because if it had waited till Monday, it might have been a very different
Right.
outcome.
Yeah. And he was
So,
actually surprised that this happened to me because I had had the same surgery previously. So, I loved, not that I loved seeing concern on his face, but you can genuinely see the concern. And he was 100% about just making sure everything was right with me. He did continual follow ups. Shelly, his nurse, is phenomenal. And she, was saying, okay, send us more pictures. He wants to make sure everything's okay. And just the follow up and the bedside manner is second to none.
yeah, I think, and I've been so spoiled because I've worked, almost grown up in this practice.
Right.
But it is interesting to find out from people who have surgery elsewhere, or if they're even just coming to us and asking, for a consultation,
Hmm.
and they'll say, oh, how many post-op visits does this include? We're like, all of them,
Yeah.
and like it's unlimited.
Right.
That's not something that we even think about because it's
Sure.
just how we operate and how we operate in wanting you to have the safest, best experience and sort
Right.
of that, that it doesn't, we're not going to clock you out at like, oh,
Hmm.
sorry, we can't see
Right.
you. We'll see you over and over. And I think that really is sort of a practice differentiator because
Hmm.
we have 6 amazing surgeons, but there's other good surgeons out there. And
Sure.
so when it comes down to sort of that connection with the practice
Hmm.
and sort of that you're, Nurse Shelley, she's been around a long
Yeah.
time. I love it. Back when we had a dermatology division, kind of between 2005 and 2010 is when we hired Shelley and,
Oh, that's
and
awesome.
now we're 2024. So,
Yeah.
it's like our team's been around a long time, but it's also that, we'll take care of it and we're not going to nickel and dime you
Yes.
on a
No.
post-op visit or something like that,
Yes.
which
Right.
wouldn't even cross our minds. But I like what you said, doing it for yourself. And that's, I think, the key because the end of the day, it doesn't matter what anybody else thinks. It's how
Right.
you feel. And so, okay, how did you have to go get all new bras?
So I'm just wearing little bralettes. I mean, before I actually was only wearing a bralette too.
Mm.
Like the only issue before was just the breast tissue that had formed below, but I could get away with wearing a bralette. They weren't like, it wasn't terrible. And plus I didn't want to accentuate the size. So I would just wear bralette. So I'm wearing the same brand of bralette now, but just in a size medium. So I'm not
Oh,
wearing a regular bra. And they don't want me wearing underwire anyway. And I don't,
right.
there's nothing to underwire really. So so nice.
Well, that's so exciting. And do you
Yeah.
feel okay? I know that as my breast size have changed over the years,
Mhm.
like you can feel fatter or thinner
Oh,
almost. And you're pretty petite, right? You're not very tall.
no, I'm 5'5".
Yeah.
Yeah.
So, like, do you think that that's helped you kind of feel
Oh gosh.
more proportionate, I guess?
Yes. 100%. I mean, in every picture, they just made me look larger in photos and in my clothes. In fact, this blouse that I have on, I've had for a while, and every time I would put it on, I'm like, my breast would be from here to my rib cage because once I had the bralette on and it just made me look a lot heavier than I was. So that was, it was an insecurity of mine is that everything I put on, I just looked bigger. And
Mm-hmm.
no matter how hard I worked out, that would never change.
Right.
So that was one of the deciding factors as well, is that, I'd buy these new sweaters and tops that I liked wearing form-fitting things, because if I wore baggy, then you wouldn't see my waist because I had a smaller waist, but then it just accentuated the top, and it was just, it just got to be too much.
Yeah. Well, thanks, Jaime,
You're
again.
welcome.
And it was really fun to catch up with you.
I know.
And I hope that maybe, in 17 years, we'll be able to have this same conversation. Who knows? All right. And
Thank
everybody
you.
who's listening, thanks for listening. We'll put links in the show notes. And if you'll subscribe, that would be great. And just so you know, if you're listening on a podcast platform like Spotify or Apple, that's great. But we also have video of all of our sessions over on YouTube, on our YouTube channel. So we'll put that in the show notes as well. Thanks, everybody, and have a great day.
Thank you.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code PODCAST to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Ximed building on the Scripps Memorial Hospital campus. To learn more, go to LJCSC.com or follow the team on Instagram at LJCSC. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.